Welcome everybody to our first webinar of 2026. My name is Carly Saw and I'm going to be presenting to you today a webinar about understanding psychological hazards and risk management in 2026. Now, I normally would be joined by Ella, but unfortunately she's unwell today. So I'm going to have to jump in and pick up some of her stuff. I almost had a slight technical issue before we started where my my PowerPoint started to go a bit haywire, but luckily it was all saved and recovered, so we're good to go. So I would like to start by acknowledging the traditional custodians of the land in which we are all working from today and pay respects to elders past, present and emerging. And I'd like to extend that to any Aboriginal or Torres Strait Islander peoples who are with us today. So just to introduce myself, I'm Carly Saw. I'm the founder director of Strawberry Seed. I've been 30 years in HR this year, and just over halfway through my career, I ended up starting Strawberry Seed nearly 13 years ago. And it's been a bit of a journey. So just about myself, I'm true crime obsessed. If I'm not listening to it on a podcast, I'm probably watching a documentary on it. And I'm a very passionate AFL Brisbane Lions supporter. Now, Ella unfortunately can't be with us today. She is our HR coordinator, but I want to give her a big shout out because she has done so much work on putting this together today and also putting together some of our resources, putting together our new service we're going to be providing in this space. So Ella has a double degree in HR and Psych, so she's quite passionate about this area. And, I just want to make sure she's fully acknowledged because she did a lot of the work for today. This is the rest of our gorgeous team. We provide HR support and recruitment support right across Australia to small businesses predominantly, but basically any business that needs help from hiring to firing and everything in between. So let's get into it. What are we going to cover today? We're going to be looking at what actually are psychological hazards, how do they actually show up at work, and why does it matter? What we can do to sort of try and recognize early signs, but also I'm going to finish with some really hopefully practical steps for you to take to ensure that you're managing them. And I really hope that you'll walk away from today with a better understanding and hopefully some reduced anxiety in this space, because I do know that there have been a lot of people that have had some increased anxiety about this, particularly in Victoria. So, I think once you really get into it and understand a bit more, it becomes a bit clearer that you're probably doing a lot of the things that you need to do. So, why is this topic mattering right now? Why is it so hot right now? Now, if you're in Victoria, you're certainly going to be heard a lot about it before Christmas because we had new legislation changes that were made from the 1st of December. They're not new. It's not a new thing, but there have been over the past few years a change in expectations on employers, and that has certainly significantly increased. Now, for those that are not aware, the majority of states in Australia are under the Work Health and Safety Act. Victoria did not follow into that act. They stayed under the Occupational Health and Safety Act in Victoria. And then I think South Australia may also be on their own legislation and possibly WA as well, but maybe only in some areas. I'm not 100% sure on that. What was a significant change at the end of last year? It has always been a requirement, right? To actually, or particularly over the last few years, to be looking at psychological hazards. And, this has come about because there's been a lot of changes in how work is performed, particularly through the pandemic. There's a much greater awareness of mental health. Certainly when I started in HR 30 years ago, it just wasn't something that was spoken about. Workplace health and safety obligations have evolved in this space, meaning, and basically the outcome of that is that businesses can't just treat it as something separate or optional. It is now just part of what you actually have to do. Now, in Victoria, the real change that came in was that Victorian employers now have a very clear, specific legal duty when it comes to psychological hazards. It's no longer just a bit of a general duty, do your best. If something pops up, you should deal with it. There is now very much Victoria's raised the bar to kind of go, no, you have to not only show that you're dealing them with whether they arise, but you have to actively be able to demonstrate that you're preventing them. And look, the other states are watching. They are going to be following suit. Victoria has been a leader in this space, and they will be watching to see what happens. And the thing is too, even if you don't have that real positive if you're, New South Wales or Queensland or another state, and you don't have to have that same level that you have in Victoria, the fact is you still have to provide a psychologically safe workplace. And doing the things that are required to meet the Victorian legislation is actually going to mean that that happens. So there's a lot of value, and in fact, a lot of large organisations are just automatically just going, we're just going to go for the top standard in Victoria because the other states are going to follow at some point, and we might as well do it the best we can now, and hopefully that will reduce the fact that we will have issues in the future. So employers often struggle because the fact is that physical hazards are a lot easier to identify and manage, right? It's a lot easier to see a tripping hazard in the hallway or understand that that machine could hurt somebody. Whereas a psychological hazard may be a bit harder to see, and it might also be a little bit harder to discuss. You might not know how to raise it or what questions to ask. And a lot of leaders have sort of raised that they're really worried about saying the wrong thing, or they're not confident in what their obligations actually are, and they're not sure what they should be doing, and they don't want to actually make things worse. And one of the things I'd like you to take away from today is that doing something is better than doing nothing. And, hopefully as we go along, that'll become clearer. So I also want you to remember that it doesn't have to be a perfect system, right? Like, you don't have to have every single thing in place. So many people hit the panic button on the 1st of December last year. And the thing is, like, the obligations to have a psychologically safe workplace hadn't changed. It was just that now you're going to have to demonstrate how you're doing it. And I think that a lot of people who weren't consciously thinking about it went, oh crap, I haven't actually done anything. But those that had thought about it in the past, and I think as we go through, you'll realize that you may already be aware of some of these things and doing them because you're a good leader. And, a lot of the things I'll talk about today actually do cross over when we do leadership training, because if you want to create a great culture in your organization, if you're doing the things here, like you're probably already doing them if you've got a great culture, right? So, but it's being more thoughtful and more pointed to what actually needs to happen, because not everybody is going to just naturally understand that that is how it should be done. So it's about small practical steps. If you take them early, and you get there before things escalate, then you're winning. It's not about having a perfect system at all. So let's sort of get into what psychological hazards are, but also what they're not. So psychological hazards are any aspect of work that could have the potential to cause psychological harm if they are not managed effectively. Now, they're going to relate to things such as how work is designed, how it's organised, how it's managed, but also how people interact within your workplace. Now, I know that feels really broad, and they are the sort of broad main areas, but honestly, a lot of these things are exactly the reasons we end up with calls about people's performance. And often something that is someone thinks is a performance or behavioural issue is actually something in the workplace itself that is causing that situation to occur. Not always, but sometimes. So it's really important that, unlike a physical hazard, you recognise that it may not be visible to the naked eye. It's more common that a physical hazard is something you can see, like it's in front of you. Whereas a psychological hazard, it might not be as visible, and it might build over time. It could be a bit of a snowball effect. It starts out as something small, but because it's not dealt with and not recognised as being a potential hazard or risk, that it starts to get bigger, and it's not until it's a really big snowball hitting somebody that you actually do notice it. And that's why it can be a bit trickier to work with. So, on the other side, what isn't a psychological hazard? What they are not, it's not about individual weakness, whether it's resiliency, whether it's about mental health conditions. It's got nothing to do with any of those things, because what it actually is about workplace systems, practices and behaviours that can increase the risk of harm. So we're not talking about whether one individual employee is coping at work. We're not talking about whether one individual employee is stressed, or, we're talking about the whole, how work is done within your business, and ensuring that the way people behave, the way work is done, the things that become custom practices within your business are not something that is going to increase the potential harm to someone psychologically. So the focus should be on improving working conditions, not fixing individuals when it comes to psychological hazards, right? And when you think about it with a physical thing, risk, we're trying to remove the risk so someone doesn't hurt themselves. That's not necessarily aimed at one particular employee, right? That's aimed at, you know, the risk of anybody who will come into that situation in your workplace. And it's the same with psychological hazards. If you can influence and control those hazards within your workplace so that they don't become an issue, then, you know, because it's a good place to work and there's not things that are going to cause harm, then, you know, the majority of people won't have any harm to them. So it's just being a little bit more holistic than thinking about individuals. And also just really defining the difference between mental health and psychological hazards. So, you know, again, it's the work-related risk factors that you can have influence and control over. You're not going to be able to influence and control what is happening for an individual because mental health is an individual experience and that's for that person. And it's going to be shaped by a lot of things and it's going to be both inside and outside of work. Certainly a workplace has the potential to make their mental health worse. And particularly if someone's already coming from a low base on psychological safety, it might not take a lot to actually impact them. But if work impacts their safety, whether it's physical or it's psychological, then work can be liable for that. So you need to ensure that you're managing risk so that you're not you don't have a workplace that's unintentionally increasing an individual risk. So it's, as I said, about reducing that risk. But you're not a mental health professional. You don't have to be a mental health professional. If you happen to run a business where you are a mental health professional, that's great. But that's not what psychological hazards and risk management is about. So, what are some of the common psychological hazards that you might come across in the workplace? Some of the examples might include sustained high workloads. Now, the word sustained is really important there because there will be situations, whether it's during a peak time, whether maybe you've got your down one employee, where or you know there's a critical project going out that workloads might be high for a period of time, and and people can manage that for a certain period of time, but it will end. That sustained high workload where it just doesn't ever end, that is what can start to really be seen as a hazard. When there's not a lot of clarity around roles, like so often we get calls and there's an issue or conflict in a workplace, and it's often caused by the fact that people are not clear on what their role actually is, like who does what, and who should I go to. They don't understand their own role, but also other people's roles around them, which means you can end up with double up on work, people sort of having big conflicts that could have been avoided. Because if you were clear in the first place about what everybody's job was, then they would know and they wouldn't end up with extra anxiety or fear or frustrations that can come from that situation. Poor support or supervision. If your leaders aren't, doing their job, then people can feel unsupported. They can feel like they don't know who to turn to. They can feel like that someone's not listening to them, not helping them when they do need it. Or they might not be being supervised. So therefore, they're just feeling like, well, no one cares about what I do. There's a whole ream of things that could come from that. Workplace conflict, that's probably one of the more obvious ones that I think people would think about if I was to sort of take a poll. Because, conflict not only can affect the people who are in the conflict, but all of those around them as well. Can make for a pretty poor work environment and can definitely affect your culture. Bullying or harassment. Now, there have been laws in place around these for many, many years. I've done a lot of training in a lot of workplaces in this space. But if it's going on in your business and you're not dealing with it, that will be considered a psychological hazard because it is a known risk to your business. I've had that conversation with clients often when I say not only like if you're aware of bullying and harassment, even if the employee says they don't want you to handle it and it's going on, guess what? There's a known risk in your organization and it's a risk to those who are involved. It's a risk to those around it who are seeing that it's happening. Poorly managed change. Change happens a lot. Change management is one of those terms that I despise in HR, but it's important because I think roles evolve constantly, right? And organizations evolve constantly. And so change is kind of normal, but it's how change is managed and supported that really matters because if you're introducing some new systems and processes into your business, if you're going through a restructure, for example, the way you manage that, if you manage that with clear communication and support and transparency, then even if people are affected, they're at least going to feel like they're like secure and that they know what's happening. When it's done in a way that people don't know what's happening, they're like, they're scared or fearful about what's going to happen, they don't feel like they're getting the support they need to actually work in the new systems or processes, then that's going to increase the risk in the workplace and certainly make them feel less psychologically safe. And isolation is an interesting one because it's going to depend on the person, right? Like it's not always not none of these things are going to be a big, a massive issue for every single employee. Like it doesn't have to be, oh, what's going on here has affected every single employee. But, a lot of people are working from home now. Certainly during COVID, that became something that was more prevalent. Or you might have, be in regional area and you've got one site where there's only one employee and they really don't have anyone else sort of coming in apart from clients, someone who's temporarily working at home, or maybe but it's about that ongoing potential risk there if that isolation is going to be damaging to that person. So I did a reflection with one of my team this week. We do our beginning of the year reflections, and she loves working. She's in Queensland. She loves working by herself. She loves that she doesn't have to come into an office. Like she loves being in her little bubble up there by herself. She's happy to get involved, but she's really happy. She doesn't feel isolated because for her that actually is her happy place to work like that. But that's not going to be that for everybody. So you can't make assumptions, and there's a big difference between someone's ended up in the office by themselves for a week because everybody was at a conference and they felt really isolated in that week, but everyone's back, to that becoming an ongoing problem that's starting to really impact their mental health. So the other thing to think about here is too, often these are not isolated. Again, physical safety can often be like a one-off incident that happened in a particular way at a particular time, whereas it's more often that there's a combination of things occurring within a workplace and they get compounded if they're not addressed early. So I want you to think about what might be hidden in plain sight, because a lot of psychological hazards may have become normal within your workplace. Not intentionally, but that can happen, particularly in particular industries. Long hours, constant urgency, ongoing stress. Sometimes they're just accepted as, oh, that's just the job, right? And we can't do anything about that. And we wait until something happens and someone actually breaks before we do something. And the obligations we have now are very much about going, well, yeah, if we understand that our job has these risks, what are we doing to mitigate them? What are we doing to try and ensure that they aren't affecting someone's psychological safety? And look, there are jobs that have long hours. There's jobs that require travel interstate. There's, we run a HR consulting firm. Constant urgency and ongoing stress. Nobody really rings us very often and says, hey, we just rang to tell you that our entire team are amazing and we love them. They might ring and say, I've got a really complicated, messy issue, and they're really stressed. And it's really, you've got to be very careful not to take on their stress. Everybody thinks everything is urgent, but you have urgent issues from multiple people. Like, how do you manage that? And it's recognizing that, what are those risks in your industry or your business, and what are you doing to try and mitigate those so that they don't become serious issues? So we asked people to put in questions, and people put some great questions in. And in fact, there's 2 questions specifically that we pulled out today that we thought we were actually probably going to cover something like that anyway. So we're going to pull them out. So the first one is, what is actually considered reasonable when it comes to setting expectations for the team? And I love this. I think it's a great question to ask, because it can be hard to gauge, right? Well, I think that's reasonable to create this role and this is the amount of work, but how do I know that I'm not creating a job that's going to be too much for somebody, right? So I've tried to put some really simple ideas together that we can work with. So put very, very simply, reasonable expectations are ones that can be met by an average, competent employee doing their job properly without harming their psychological health. So they can come to what your expectations are for that role. For the majority of people, majority of the time, they'll come to work, do their job well, and there's not going to be any ongoing potential harm. Now, that should be the test, because what you don't want to test against is like, well, I'm going to compare what's reasonable against my best performer in their best week, or what we managed to achieve during a really peak period where everybody just threw themselves in to just get through it, or comparing it to someone who's doing a whole heap of unpaid overtime in order to get those results. That's not going to be seen as reasonable. And so, there's a couple of little tests you can do. Like if meeting, think about something like if meeting the expectation that you have set is regularly going to require an employee to have stress, to be exhausted, it's going to cause fear or personal sacrifice to achieve it, then it's probably no longer reasonable. And it may be seen as a psychological hazard. I think as business owners, for those that are business owners that might be on this webinar, we can't measure what we would do or what we find reasonable for ourselves to our team, because it's unreasonable to think that a team member would have this, would put in the same hours that you might do for something that is your livelihood that you've built. And you need to be like quite cognizant of that. And I've seen people who are like, but why I do this and this and this. I'm like, that's great. That's your choice. That doesn't mean you can create a job that, is too much for people. And I think if you sort of sit back and really look at like, can this be achieved? Now, if it's a job that you've had for a while and that you've had many people do that job at that workload and they've coped, and suddenly you've got someone who's, started, or something's happened and they're no longer coping, the fact that, it's always been very sustainable and hasn't really caused any issues, but now suddenly is, means it may be much more likely that it's an issue for that individual rather than overall. But you've got to make sure that you're aware, particularly when you're creating new roles, that, and you might have to adjust as you go, because sometimes, and the other thing is roles grow, right? They grow over time. Someone leaves and then everyone picks up a little bit extra work, but nobody really thinks about what that's going to mean long term. And then they go, oh, we're doing really well, so maybe we won't replace that person. And now everybody's actually got more work than what's actually sustainable. And it may not be that first week or that first month, but over time it will start to have an impact. So, what are some of the things that you might see arise day to day? So, it's very rare, as I mentioned, that they're going to stem from a single incident. It's much more likely it's going to be the straw that broke the camel's back, right? So, they often develop through just everyday workplace practices, and that might be constant time pressure, under-resourcing, unclear priorities, poor communication, limited opportunities for recovery. So, again, you might have times in your business where we middle of the year when we're doing our benchmarking, there's 3 weeks of hell where everyone's just trying to get as much done as possible, and we're trying to share the load and we're trying to give everyone a little break, but we all know that that's what we're going into. So before we head into that, before we do that, we actually think about, well, okay, let's make sure that people aren't getting any other types of meeting during that time so they can just get done what they've done. But also, I don't want them doing that 5 days a week, because they're going to need a break from that, to sort of have a little bit of a respite. So let's kind of share that around. If you're understaffed at that point or someone's off sick, again, it can elevate these things during periods of time, but they're unavoidable. You don't necessarily have the control, but what can you control and influence? Well, you can control and influence how you support people through that time, how you communicate with them, how you help them work out what their priorities are, and giving them an opportunity for recovery at the end. I took a couple of my team to a business show in November last year, and we had 3 really busy days. Like, those full days at a business show, for anyone who's done them, are just full on. We were up, the show was on, the Wednesday, Thursday. We were up there from Tuesday, and on Friday I said to them, I'll fly you back whenever you want. And they said, oh, we'll take Friday's annual leave. I said, no, I want you to take Friday. I wanted them to have a day to recover. I wanted to say thank you and give them that time to actually recover. After a peak period, what can you do to give people a little bit of space to allow them that time to recharge their batteries a bit? They also, a couple of examples here to share with you. When we have my technical issue, I've just realized some of my notes have disappeared. Just a couple of examples that might help explain in a bit more detail. So you might have a situation where you've got a team that is navigating frequent change. They've got some tight deadlines. There's ongoing staff shortages. So their priorities have to shift. Expectations are now unclear because everyone's role's kind of chopping and changing, and they're not getting the support. It's inconsistent. So what sort of impact is that going to have? over time, and again, might not be the first week, might even not be the first month, but over time, their stress levels are all going to rise. You're going to start to see communication breakdowns. You'll start to see little squabbles and conflicts, and people getting snippy with each other and maybe being quite short in their communication or not communicating with somebody else. Um, Performance is going to suffer. And, again, there's a financial impact from this. This is why, I mean, a lot of these things that, some people might be looking at these going, oh, that's a bit of a no-brainer. Of course, you just have to do this, this, and this. Then you're probably got a fairly psychologically sound workplace. And you might find that you go through a risk assessment, but know that you already have things in place. It's when you don't that's a problem. And you've got to remember that what can begin as a short-term pressure can become an ongoing psychological risk. And that's definitely linked to work design and role clarity. So in those sort of situations, often, roles change, but with no, it wasn't a thoughtful change, it was a reactionary change. And nobody's really sat back at once things calm down and go, hey, can we just make sure everybody's clear on who does what, whether that's themselves, whether that's what others do. And that happens particularly in growing businesses. It's not uncommon, but it's making sure that you take that time to keep readjusting and resetting so everybody's on the same page. Another situation that could be a good example is an allied health team. They're managing a full book of appointments. They've got clients with complex needs. The admin's just increasing, and you've got clinicians who are trying to meet billable targets, complete documentation, and still provide a high quality of care, but suddenly they're getting less and less time between clients. Like they don't know when they're going to get things done. Now, again, this can happen. It can happen when people are understaffed. It can happen, some of our allied health streams I know find it really difficult to find someone. And if someone leaves, it's not a case of, I can get someone in straight away. So often others, particularly being in a caring industry, will jump in and want to take them on. But, short term that might work, but it's not a long-term solution. Because the impact is going to be things like over a period of time, you're going to see cognitive fatigue, you're going to see emotional load really building up. Their focus is going to drop, and there's a real risk to their health. They might burn out. The longer somebody goes without the ability to have a break or just sort of take the accelerator off, then more likely they're going to end up with more longer term issues as a result. So, again, why does all this matter? Unmanaged hazards are going to affect more than just the individual well-being. They are actually going to have a flow-on effect across the entire team, your culture, ongoing performance, and actual business sustainability. So at the employee level, you're looking at things like stress, burnout, disengagement, reduced confidence, increased absenteeism. And again, we've already talked about it, they're not going to develop overnight and just be there. It's going to develop gradually and may not be immediately obvious. You might not see it at the beginning. They might hide it really well. But over time, little things will start to come up and start to show themselves. So even if you didn't realize early, the earlier you can act, the more you can reduce potential damage. And so, it can be difficult with things that are not always obvious. Definitely it can have an impact on the ongoing team and culture overall. So you're going to see an increase, the things you might see are increases in conflict. There's a reduction in trust. People don't necessarily trust each other as much. Communication gets poorer, morale goes down. And again, over time, this is going to lead to more disengagement and higher turnover. And that's a cost, that can be a real cost to businesses. And it's not what we want. I mean, I don't know any business owner that goes, I don't care about my culture. I don't care that this is a terrible place to work. I don't care if I have high turnover. For businesses, unmanaged psychological risk can result in things like reduced productivity, performance issues, higher recruitment costs, increased complaints, more and more people coming to you to complain, and definitely potential workplace health and safety exposure. And I guess that's what we're really talking about today, because we're talking about the laws that require you to actually manage these issues. And if you're not, then you're actually creating a risk, and it's a legal risk for you. And it can be personally for you too in a small business. So, in terms of work health and safety, you have a duty of care to provide a safe system of work so far as is reasonably practicable. And this means managing psychological risks and physical risks, not one or the other. I think we've been very embedded over years and years and years of legislation of knowing we need to provide a safe working environment physically. But it's, not everybody has really shifted to realize that the psychological side has just as much weight. And so at those higher levels, you're going to be expected to identify any potential hazards within your workplace and industry specifically. Assess what the level of risk is. You might assess the risks and go, actually, that's quite a low level of risk. I don't actually have to do anything at this point. But in other times you might. You need to implement appropriate controls. You need to put things in place to prevent it happening. How are you going? What can you influence and control to sort of make sure it doesn't happen? You need to review these over time, and you can't just set and forget. And so we're going to start getting into some practical steps shortly, but I want to talk a little bit now about some of the early warning signs that you might see that might trigger, oh, I might need to look a bit further here. So if you identify early signs in individuals, that can actually help prevent harm and prevent it from getting bigger. Have an awkward conversation early rather than a hard conversation later. Um, don't wait for a formal complaint or a serious incident before taking action. And I think that's what a lot of people just tend to do. Like I don't until someone tells me there's a problem, I'm just gonna look away. So some of those early indicators might be there's changes in behavior. Someone who's normally happily and bubbly is no longer happy and bubbly. Someone who's normally really calm is now snappy with everybody. They're making more errors, they're withdrawn, they're irritable, absenteeism has gone up. Not every one of these is going to mean that there's a serious issue, but look for patterns in behavior. Like someone having one bad day might be just having a bad day. But if you're starting to go, hang on, there's a pattern here, there's a bit of a change, I'm feeling there's a difference, you should be actually trying to work out what's happening. Um, Signs where there might be some more broader issues across the team. You're seeing conflict rising. You're seeing more little spot fires that you need to put out. More people are coming to complain. Like again, it sounds like a no-brainer, but these are little things that when you start to pop them all together in isolation, you might not think anything of them, but popping them together means that, well, hang on, what's going on to cause this? What's the underlying factor here? Silence when there has not been silence before. When you're used to walking through your workplace and hearing, people chatting and like it's just a little hum and suddenly it's just dead silent. That would be something I'd want to investigate. Reduce morale and turnover. All those sort of things can be early warning signs. But now I want to spend the rest of our time together really getting into more of the practical steps that you can do. Because I think as employers, there's lots of things that you can do without even having to really go into, very high level, formalized systems. Like, you don't, it's about what you're doing and how you're doing it and the actions you're taking, not about how something is written on a piece of paper. So there is not going to be a one size fits all approach. Every workplace is going to be slightly different. They're made up of different people. They have different environments, different risks. So, it's got to be proportionate and realistic and suited to where you're working. What you're going to do in a business that has 5 employees is going to be incredibly different to a business with 100 employees and 4 locations, right? So I want you to really think about that. What you do in practice is just as important as what you have written down in a policy and a procedure. I would hope everybody has a policy around psychological safety in their workplace. That should just be a bit of a no-brainer now, and around bullying and harassment and conduct and things like that. It's certainly all of our clients do. And it was interesting when the laws in Victoria were changing last year, a lot of people rang and said, oh, is our policy still compliant? It didn't change our policy. But the policy still said we have to provide a psychologically safe workplace. What changed was your obligation to actually, you will have to be able to demonstrate if you're ever questioned that what you have done. It won't be enough to just have that policy anymore. So, first step is to talk to people. This is about spotting risks early, not running a once-a-year survey. Now, a once-a-year wellbeing survey is lovely. It's fine, but you want to talk to people often. You want to talk to them about the right things, and you want to listen as well. So in practice, what does this look like? Well, Are you doing regular check-ins that don't just talk about what we're going to do today and what we're going to do tomorrow? Do they explore where their workload is at, what pressure points they have at the moment? Is there things that are making their job harder so that you can recognize these early and make adjustments as you go? You might want to think about doing short little pulse surveys, on a more regular basis. Again, these are just examples and ideas. But the real key here is you've got to have open conversations where people feel safe to raise concerns. If you're the person who is setting the expectations around things that are probably unhealthy within the workplace, I can guarantee you people probably won't raise them with you. They won't feel comfortable. If you've got to build trust, if you have a great culture and have trust with your team, this is easy because you can have conversations with them and you can say, look, tell me so I can help fix it. So the real key here is not just listening, but actually acting. Because if you do all the surveys, you go out and you consult with your employees because consultation's a big part of it. If you do all these processes and then you get some great information and then nothing happens, you're actually creating more risk and not trust. Because I spoke to a client before Christmas, it's not as a potential client, and they said, one of the things that problems they've had is in the past, like the owner loves to do a survey. So everyone just goes, oh, it's another survey. Yeah, whatever. And nothing ever happens. It's like people think that the act of doing the survey itself is actually ticking a compliance box. Well, if you did the survey and you didn't do anything with the results and nothing changed or nothing was improved or you didn't at least share that feedback with people, then why did you do it in the first place? If you're doing it to just tick a box, it's a bit like saying, oh, well, we have fire extinguishers, tick, we do fire safety. We have a fruit box, tick, we do wellness. It's not a tick of the box exercise. It's about actually making sure that if you identify risks, you do something about them. The second step is to actually review work design in your business. So most psychological hazards live in how work is actually designed. So, and by that I mean, how is that job designed? Like what responsibilities and workload is given to that job? Like the way it is done, like is it having to be done across 4 different locations, which means someone's traveling all the time? Is it having to be done in a way that this person's constantly interrupted even though they're trying to do deep work? Like there can be a lot of things that are very obvious, but some that aren't. So you want to be actively reviewing workload and pace, particularly when are your busy periods, and has that become the norm? Is what in the past was a busy period that we kind of went through peak and it would just come back down again? Has that busy pace and load just be that sitting just below the surface of full become normal? So any little extra thing is going to throw it over the edge. Making sure everybody's very clear on their roles and about what they need to prioritize. If they've got competing priorities, they need to understand where you want them to be spending their time and how they should be prioritizing their time. Resourcing and coverage. Do you have enough people to do the job? Have you grown and everybody's role's grown and you're at the point now you need to bring in a new person because everybody's doing more than what is reasonable for one person. And then we can bring back more workload and resettle again. And I understand it's hard in a smaller business because, you can't just always bring in new people. You often have to almost get to breaking point before you can afford to bring in that new person to justify it. But you've got to be on top of it because if you don't get it in early enough, you might find you lose the people who are good people as well, and that's going to cause you problems. Your expectations as a leader around availability and after hours contact are really important. You've got to set an example. You've got to be the change that you want people to be. You need to be clear about what your expectations are. And look, particularly for those I know that might be on here in allied health, I'm sure you have some of the same problems that I do, is that I have a team that are very empathetic and caring and supportive and want to jump in and help our clients. And I really love that, but they will often do it at their own detriment. They'll say yes to something or give an unrealistic deadline because they want to help immediately. But then they put themselves in a position where they're now got too much work on. And there's often a flow-on effect to other members of our team as a result of that. They've got to jump in and help. And, I know, and even when it's coming from a good place, though, it can be detrimental, right? So it's, some people have the problem that, the leader is causing the issue, but other times it's the employees who are kind of going too far and you're having to bring them back in and going, hey, no, I don't expect you to call in when you're on leave. I don't want you looking at your emails. I do want this. And so you have to really be clear on that. And now we do have the right to disconnect laws. But, again, if you think about those laws, they are like, yeah, people have the right to not be contacted outside of work. There are exceptions for when it's an emergency and other things, but really what we're trying to do with the laws is make it the norm. So you need to, if you don't want your employees working longer hours if they can't get their work done, you need to say, no, no, if you've got too much work to do, you need to come to me so I can help work out if someone else can help you or what we can do to manage that workload. And certainly when we do leadership training, we talk about delegation. One of the first things I say is, if you're going to delegate something to somebody, that's great, but what are you going to take off their plate to ensure they've got the space to do it? Because if you're just continuing adding, then you're causing problems. And also how change is introduced to managing your business, being more thoughtful about it, making sure that, it's not going to overload people and you give them the space to learn new things and to do what they need to do. So remember that small system changes can often have the biggest impact, and you may not be aware of it from where you sit. I'm very aware of this. We've been doing a lot of change in the last 12 months, and I'm taking the feedback of my team, and I know it's been, a lot of change happening. I try and, I'm trying to get a lot better because I'm someone who goes, oh, here's an idea and I just want to get it out there. So I'm trying to get better at that too. Nobody has to be perfect at this, but you've just got to take the time to listen and work out what you can do differently. So for example, in an allied health clinic, you might introduce a buffer between appointments to reduce that cognitive fatigue that people have, or limit the number of appointments they have in a day, or make sure they have time to do their administration. I know there are still businesses out there who go, oh, well, they've got to do almost, if they get behind their admin, they've got to do it in their own time. But ask yourself why they're getting behind their admin. Is it a skill and knowledge deficit, or is it actually the fact that they just don't have physically enough time to do it? And I mean, look at other solutions too. You can look at solutions like having AI that can take notes for them and help them, and but you've just got to be looking at it and going, what can I do to sort of, it's about helping increase productivity, but helping people do things in a sustainable way. Um, Now we need to support our leaders to spot and manage risks. Often the leaders are the closest to the work. If you have different locations, different teams, those leaders are often the ones that are at the coalface, not necessarily the owner of the business. And so everybody in leadership needs to be trained and equipped to manage hazards, and just to identify them. So, they need clear guidance on what are some of the common hazards and what things they should be looking at. They need training on workload and behavior changes and work design so they know what to look for and how to manage that and how to intervene early. And there needs to be some clear escalation pathways, and decision authority. So, if they identify something, what should they do about it? How are they authorized to manage it? Do they raise it with you? You really need to sort of think about that. And also, if you have, because you need to have some sort of system where people can raise grievances and things with their managers, are they aware of that? Do they understand what to do when that happens? So when leaders know what to look for and what to do, the issues can be addressed much, much earlier, which the earlier they're addressed, the much more likely they're going to be small and they're going to be able to be fixed quite easily. So, if a leader's noticing that there's a whole heap of errors now during a peak period with somebody, and then they're going, okay, well, this person never normally makes errors. What's causing that? Just check, they could do a quick check-in and say, hey, what's going on? I'm like, oh, sorry, I was trying to do 10 things at once. Like, okay, well, how about we help you organize that or help you prioritize it? Can we take something off you and get it to someone else? Because this needs to be accurate. So let's give you a bit more space to do it. Whatever it might be. The fourth step is to create clear and trusted pathways so people know how to raise those concerns and what will actually happen next, and also trust that something will happen next. So clear reporting options, they know who to go to if they have concerns, have very transparent processes and access to appropriate support. You also want to document actions and outcomes. So when somebody does raise a concern, what are you going to do? If someone raises a safety hazard with you, what do you do now? Do they know who to go to, and they say, oh, by the way, there's oil spilt down on the driveway, and then they know who to go to report that, and that person makes sure it's fixed. Well, you need to have that for psychological stuff as well. Should they come to you? Should they come to their manager? What sort of things should they be raising with you? And if they do raise it, make sure you follow up and document those actions and say, look, we took on board what you said, and here's some changes we're making, or look, we can't make this change for now, but we know this is going to finish in a week. Again, it's very hard to get too specific, and it's an hour pre-work webinar, so it's hard to get into the nitty-gritty, but you need to make sure that you've actually taken it seriously, and then also follow back up with them so that they know that it was the right thing, and say thank you for bringing it to my attention. It's such a simple thing. It lets them know that, yeah, actually no, you want them to bring things to you so that you can fix them early. So clarity is going to reduce anxiety and build confidence in the actual process. So if an employee has workload concerns, and they come to you, actions are taken, you take it seriously, you follow up, and even if it's an incremental, slow solution that can't be immediate, but they see those actions happening, they will trust that, and they will actually appreciate it, and it will immediately reduce their stress levels because they know that it's not going to be this way forever. Step 5 is review, adjust, and repeat. It has to be ongoing. It can't be a set and forget. You don't, on the day you open your business, do a safety assessment and go, well, we're done. We never need to do that again. It just can't be like that. There's too many variables and factors that can change, and you need to be looking at it ongoing. So you need to review what your hazards are, what controls you're putting in place, and once you've implemented those, you need to actually make sure that you're seeing that they work. Is this working? Have actions actually we've taken, if they worked, have they managed to change something? Has that improved? Has that not improved? Do we need to adjust something? We thought this was going to fix it. It's actually caused more issues. Okay, we've learned from that. What can we do differently? Review, adjust, and repeat. It's not a set and forget. So if you regularly review, it also shows prevention, but it also demonstrates, if you're ever questioned about what you're doing, that you're not just doing a box ticking exercise. You're actually taking the time. So, after you've restructured, for example, you might go, okay, we're a couple of months in, let's just reassess, what are the workloads? Has it worked? Is there any adjustments we need to make? Because until something's in practice, often you don't know. And I'm not saying that these things are always intentional. Often they're not. Often they're outside of our control to a certain extent. But if you've hired a new role, and when the person started, you're realizing pretty quickly that this is just too much work for one person, adjust. You've got to not just set and forget. So another one of the frequently asked questions that we got from someone who registered was, how do we prove we are preventing psychological hazards? Because obviously now in Victoria, you need to be able to show and demonstrate that you're doing it. So I'm just going to go through some ideas on, how that will work. So the short answer is that you prove it through evidence of action, not intent. You can have the best intent in the world. If you didn't do anything, having a policy that says we're going to do all these things and never doing anything, it's not going to cut it. It's what you actually did, and what happened. It doesn't have to be perfect, but it's got to show that you've actually tried. So the first is, what sort of evidence can you have of risk identification? So they're going to be, how can you show you've actively looked for risks? Well, maybe you did a survey of employees and you've got summaries of that. Maybe you then had team discussions and there's notes from those, notes from consultations with employees. You've identified risks in a register or a hazard log, like here's what the outcome was of our risk assessment, and here's the things that we've planned to do. So again, it doesn't have to be perfect, but it does have to be deliberate. It can't just be, oh, well, if you look at this email over here and you look at this Slack message over here, like if you put them all together, it kind of looks like it. No, make it deliberate. Say, hey, we are going to do this, we're going to review it, and here's what the outcome of that was, and here's what we're going to do next. So the sort of evidence that you would have of actually taking action is basically, it's demonstrating what you've done to try and implement change. So did you make adjustments to workloads or rosters or targets? Did you make changes to roles? Did you redo job descriptions? Did you meet with everybody one-on-one? Did you provide some additional resourcing? Did you plan for a peak period with some temporary controls that will help manage that? If you're doing things, you'll be able to prove you did things because you did them in the first place. How do we prove that we're preventing psychological hazards in terms of consultation? Now, consultation is a requirement under the Victorian law. It is a legal expectation and not a courtesy. And basically, this is about going, you don't sit in isolation. and decide what the risks are and decide what the fixes are. You have to be involving your employees in this process. So there's a legal expectation that you will be having conversations with them, that you'll be gathering information from the source and then using that and then talking to them about what that means and what could be fixed. It does not mean that you have to do absolutely everything that anyone says to you in a consultation, but you need to listen and you need to have gone through that process. So you want to make sure that there's records of meetings that you've had or feedback sessions with teams. There would want to be communications showing that you have sought and considered input, and maybe follow-up messages or meetings where you explained what was going to change and why, and maybe why what they might have suggested didn't change. Um, Evidence of leadership capability, and you need to be able to show that your leaders are playing a role. So that could be training records. So doing training with your managers, doing training with all your employees, being able to demonstrate that your leaders had something that could help guide them in those situations, that they understood what the processes were for grievances, what to do next, what to do if they did identify a risk early. And that it's very clearly documented what the expectations and pathways are, and then if someone does raise something, how is it responded to by that leader in that situation. And the final one is evidence of review and follow-up. So that your evidence that you're closing the loop, that you're continuing to look at prevention, and you're actually not just setting and forgetting, you're actually coming back to check that controls are working. So that after there is some sort of incident or complaint that you implemented something. What did you do? And then later on you came back to see if it worked and made some adjustments and checked that it had worked or it had not worked. And then, so it's ongoing monitoring, not just a one-off action. So the bottom line for employers is you do not prove prevention by having the right words in a policy or having one training session. You prove it by showing that you identified the risk, that you took action on them, and that you reviewed and adjusted them over time. And if you've done those things, that can come through, if you were ever to get an inspection from WorkSafe, if you're in Victoria, for example, and they should be able to walk up to your employees and say, hey, have you ever been consulted on this? Like, oh yeah, they did a survey and then we did some training, and then after that survey they had a meeting with us and they, explained it all to us, and then they've made a few changes. People will know when it's there, right? And again, not perfection. Progression, not perfection, should be what we're aiming for here. So, how can we help? Well, we are launching a new fixed price service on the 1st of February. This is something we've been working on for a while, and Ella's been very heavily involved with, which has been wonderful. So we got a new service called the psychosocial risk check, and it's I think it's a psychological risk check. I think that is me mistyping very late before a webinar. But it's a practical way to understand and manage psychological risks. So what we are putting together is something where we can help you review how your work's designed and managed and experienced in your business, and help you identify those risks. So there's going to be two options. Essentials is going to help you identify them, provide some clear and practical recommendations for you to take away in action. Essentials Plus is we're going to be with you for the long haul. So for a minimum of probably 6 months, working with you to go through the full process beginning to end, not just working out what the risks are and what to do, actions to take to rectify them and what controls to put in place, but also reviewing how it works. That will include doing training with your leaders. It will include maybe doing feedback sessions with your team. There's a lot of things that can be included in that. And again, we want to sort of give people options if they just want us to help them get started, or whether they want us to really get in and help them do the nitty-gritty. We are launching this on the 1st of February. There'll be a link to book a 15-minute call. It's obligation free if you are interested in that for your business. If you're a HR partner client, you'll be able to use your hours towards it as well. And essentially you guys will get the link early because you registered for the webinar. So we will be sending you the link early if you want to, you're interested in hearing a bit more about it. But, I think there's just a real need now that not everybody has the expertise or the time to go through and do it themselves. And we don't see this as a tick box audit. This is about understanding what the real risks are and putting some sensible things in place so that you're know that you're doing the right things. And it's about giving you a starting point to act on, but not overcomplicating it. You don't have to overcomplicate it. Now, some businesses might be more complex than others, but it's about giving you some options for help if you want it. So, final thoughts is that psychological risk management is not about perfection. I know I've said it several times. It's starting small, taking reasonable, visible steps, and they'll reduce risk far more than doing nothing at all. So, um, I'm more than happy to answer questions, by the way, if you want to throw in the Q&A. But as we finish up here, our next February webinar is Understanding Assessment Tools for Better Hiring and Stronger Teams. Tanya and Mel, it'll be nice change, not to have me for a change, are going to be running that. They're both, one's accredited in Facet 5 and one in DISC. So they're going to talk about the way you might want to use them in your business and give you some ideas and about what sort of tools are out there. So you can register for that. We have launched our 2026 training calendar. We have some similar things to last year, but also some new. So Lead with Impact is our online 5-month course. Is a leadership course. It's a mixture of live workshops once a month for 5 months with some online training as well. We did 2 runs of that last year and they were really successful. And so we've launched again to start at the end of February. We have our new leadership skills deep dive series, which we were launched in December. Our first one is in March, and that is on turning conflict into conversation. So it's all about conflict management. So it's a couple of hours just on that topic. And then we have another one coming up, I think in April, and that is a disciplinary process deep dive where we're going to be talking about managing performance issues with clarity and confidence. So they're more sort of short and sharp. And again, you can, if you've been a client with us before, you can get a discount code and they'll be a bit cheaper for you. And you can register for those. We've already had quite a few people register for these, which is great. And our leadership essentials workshops are basically what we've been our leadership training workshops in the past. The difference is this year they're going to be in 2 parts. They're going to be 2 half days of 4 hours over 2 consecutive days, or a Friday and a Monday, rather than being 1 full day of 6 hours. So we can get into things a little bit more. People are not so overloaded with information, and we'll be running them in Melbourne, Adelaide, Brisbane, Sydney and Geelong in 2026. Geelong's not till October. We've already had some people register, which is wonderful. But I think March is Melbourne and beginning of May is Adelaide. We haven't been to Adelaide for a couple of years, so we're doing that again this year. So all that information's on our website, on our training page on our website, or send it out to us. We'll put some information when we send out a copy of the webinar to you. But, as always, follow us if you want to learn more about anything or have, reach out to help. If anyone has got any questions, please feel free to pop them in the Q&A box. I can't see any right now. Look, thank you, everybody. I'll hang around till 8:30, but thank you for attending. If you attended, thank you for watching. If you're watching this on the recording, I hope you got some valuable tips or hints out of it, and we'll be able to implement some things in your business. But I'm happy to answer any questions. Otherwise, thank you. We'll see you next month at our next webinar, and reach out if you need any help as always. Thank you.